ask Dr. Emil to come and present a eulogy on behalf of the department and his division for Dr. Frank Guttman, who unfortunately left us a few days ago. Dr. Guttman was the division director in pediatric general thoracic surgery for 15 years, and I think it's only fitting that one of his ultimate successors, Dr. Emil, presents the eulogy.
Thank you very much, Dr. Farmer, and thank you, Tom, for giving me a few minutes of your precious time to memorialize Dr. Guttman and remember him. Dr. Guttman passed away on August 26. His wife, Herta Guttman, of 60-some years, who was also a very accomplished physician in her own right, passed away 2 years ago, and really Dr. Guttman's health started to deteriorate soon after that, and leading to his peaceful death in Toronto on the 26th. I had actually two things to accomplish this morning. One is to speak for a few minutes about Dr. Guttman, and the other is to introduce our new surgical staff. And it occurred to me as I was walking here that the two are really intertwined in a very deep way. In one way or another, this morning we're really witnessing the circle of life, celebrating one of our founders and welcoming one of our successors. And I know if Frank was here, he would revel in a moment like that. He truly valued mentorship and discipleship and was so incredibly excited when a new pediatric surgeon was formed, whether under him or under somebody else. And I know Hussein, he would have been giving you a huge hug if he was here this morning. So I just want you all to welcome Hussein, also our new surgical staff, and we're very much looking forward to your contributions over many years to come. Thank you for coming and joining us. I want to introduce Frank's many roles to you. Frank was a pioneer. This picture in black and white in the corner here shows him at the founding dinner of CAPS 52 years ago. And in the middle of the picture is Harvey Beardmore, who was the first president of CAPS for many years. And 50 years later, Frank was honored again at the CAPS meeting when we celebrated the 50th anniversary. And you can see him here in the middle of several founders who were able to come and attend the meeting. He really was a visionary. Frank was an innovator. This is a press conference that he gave after his first successful liver transplant, which was really the first successful pediatric liver transplant in Quebec, and has resulted in what's probably the longest surviving transplant patient in Quebec, if not in Canada. And of course, you recognize this handsome young man next to him whose smile hasn't changed. And this is also a great picture because one of Frank's real prides was passing on his legacy to Jean-Martin after he retired. Frank was a researcher. He published over 100 manuscripts, and many of them were quite profound. This is actually a syndrome that should really be called the Guttman syndrome. He defined this new syndrome of intestinal atresia after observing many patients coming from a specific area of Quebec where essentially non-survivable syndrome of intestinal atresias were found in multiple families. Frank was a teacher. He truly reveled in his students. He taught with joy, and it was just absolutely amazing to see the tributes from people he trained 40 years ago, writing back to us and telling us they still are guided by his words and by his actions, and they see patients the way he saw patients when he trained them. Frank was a leader. He led our division for 15 years, both as program director and as chief of the division. He trained 15 fellows, many of whom went on to become division chiefs, chairs, or leaders in their own right. And again, we've heard from many of them these last few days. And I know I speak for Pramod and I speak for Jean-Martin when I say that we are truly honored to have followed in his footsteps as leading the program and leading the division. Of course, Frank was a surgeon. This is a picture of him with this liver transplant patient, and he actually went on to celebrate her birthday every year, well into her adulthood, and I think until shortly before he left Montreal. But he was a surgeon who really understood that the beauty of pediatric surgery is not in the technical, is not in the anatomical, is not in the cutting and suturing. It really is in the profound trust and relationship a surgeon has with his patients and his parents. And he inspired many to see pediatric surgery that way. Above all, Frank was truly a gentle soul. And I found this picture a few days ago. It was with my daughters at the 50th anniversary of CAPS in 2018. Frank sat and had breakfast with them, and I was just amazed how he could come down to the level of little children and then a few minutes later have such a complex conversation with a senior colleague. He loved children, and he loved people. And he, the gentle soul was not just his social aspect, it was also very much in his professional aspect, in how he treated others around him and how he saw others, always accepting, always listening, always enduring. And I think of all the things that I described about Frank, that is what we will remember about him the most. In 1990, I was a medical student at McGill, and I was doing my pediatric rotation, and we had a patient who came in liver failure. And I was told by my senior resident to take the requisitions, go to the operating room, take the specimen, and take it to pathology, because we can't trust the surgeons to make sure they have all the paperwork right, and we have a lot of work to do to be able to come up with a diagnosis. So I took my paperwork, I went to the OR, OR 6 back then, and I, wasn't part of the surgical team, and nobody really knew why I was there, so I told the nurse in a very low voice that I'm here just to take the specimen to pathology. Like, okay, well, you stand up here, don't get close to anything. And I went and I cowered in the corner of the room. And at one point, Frank looked and saw me, and he said, "Oh, who are you?" And I said, "Oh, I'm a student from the pediatric service, and I'm just here waiting for the specimen." He said, "Well, come, let me show you what the liver looks like." And he started this chat with me in a room that had already 8 or 9 people. And, this was Frank. He always noticed the people whom others did not. He always looked for the person who others did not look for. 25 years later, I wrote an article that got me a lot of grief from the administration here. And many of you remember that before we moved to this hospital. Frank was the very first person to write them and say, "Shame on you for attacking him for what he said." He didn't have to do that. I didn't ask him to, but that was the kind of person he is. I would say that the only consolation we have at Frank's passing is that we recognized his greatness when he was with us. We did not have to wait for him to go. Frank started a visiting professorship, and Jean Martin, when he took over, named that the Guttman Professorship and started to fundraise. And it became a really the climactic event in our academic year every year. Invited some of the best leaders in pediatric surgery around the world to come in Frank's honor. And Frank reveled in everything that the division still was doing. Long after he left, he would follow all the events of the division. He would come to our teaching on Wednesday. He would make it a point. And this picture of Hussein's graduation, he came back from Toronto in quite ill health to be there. That was our last Guttman Professorship with Kurt Heiss. And at the 20th anniversary of the program, we endowed it and made it the highest endowed visiting professorship at the Montreal Children's ever. And I just celebrate that because I think it will keep Frank's memory in perpetuity in this hospital and in this institution. One day, none of us will be around, but one young surgeon will ask, why is this called the Guttman Visiting Professorship? And they will read about Frank and learn about him and understand why we did what we did. I'd ask you all to just rise for a few moments of silence as we honor Frank's memory. Thank you.
Thank you, Sheriff. That was extremely touching and very much in keeping with who Dr. Guttman was.